All right. Thank you, everyone. Welcome to this webinar today, brought to you by Klara and Nextech. Thank you, everyone, for joining us today. Super excited to have you join this webinar about how embracing digital trends can improve the patient experience. Big topic, which a lot of people are thinking about right now. To kick things off, I would like to introduce the distinguished panelists who are with me. First of all, we have the great Erin Deane. Erin is Chief Information Officer at Connecticut Dermatology. Erin has 10 years of pediatric and experience and 6 years in dermatology. She has performed job duties in all areas of office management, EHR, PM implementation and training, as well as participation with several third-party integrations throughout her career. Before the webinar, Erin actually let us know how important it has always been for her to have the ability to share her software experiences with other office managers and other office management teams, as she knows that time is a high priority and wasting it on software support can lead to poor practice workflows issues and staffing frustrations. So making the wrong decisions in terms of software can become really costly down the line. For this reason, we are super honored to have you, Erin, here on the panel to share your experiences. Thanks for joining, Erin.
Thank you. Thank you.
And next, we have Craig Maher, who runs employee systems and resource management at Dermatology Aesthetics in Chicago. Craig has spent most of his life in Chicago, other than a brief hiatus to get his degree in biopsychology and chemistry from Monmouth College. Since then, he has been working in all areas of dermatology, including being a histology technician, a medical assistant, various supervisory roles, and now he focuses on implementation, training, and operations involving all the many gaps required for patient care at Dermatology and Aesthetics. He has used Klara both as a patient and now obviously increasingly for operations for over 4 years now. Craig, thanks for being here. Super excited to hear your perspective on patient communication, as you've had such a wide range of career experience regarding that topic. And last but not least, I'm Simon Bolz. I'm co-founder and co-CEO of Klara, and I will be your moderator for today's webinar. So before we jump in, wanted to share a quick agenda so you can all know what to expect during the next 45 minutes. First, I'm really excited to share that Klara, our company, is releasing our first industry report. We've never done this before. It's a first for us. We put a lot of effort and time into it. It's called the 2021 Patient Communication and Engagement Survey Report. We partnered with a top-tier market-leading research firm to uncover the industry's pain points and strategic priorities around communication. We've highlighted the results in the report as well in today's webinar. So I'm gonna go through the webinar today, which is basically giving a little glimpse into the report, and we'll discuss it with the panelists. So thank you for everyone in attendance of our today's webinar. We'll be providing exclusive access to this report, so stay tuned for that in your inbox. So if you join this webinar, we will send the recording of this webinar plus also this amazing report to you. In terms of the webinar today, we'll first be spending about 30 minutes discussing the findings of the report and how our two panelists' practices are using technology to improve the communication and patient experience as compared to the findings. For the last minutes, 10 minutes, probably 15 minutes, we'll do a quick brief Q&A in the panel. So if you think of a question you'd like to ask during the webinar, please add it into the Q&A section at the bottom of your Zoom window. And depending on the number of questions and the amount of time we have, we'll try to get as many questions answered as possible. So without further ado, let's kick things off. So first of all, jumping into our report we put together with our independent research firm, there were some key findings. And the key findings were around practices identifying specific challenges when it comes to patient communication. It's a big topic, it's a big problem. There's a lot of complaints around it. It's inefficient, communication, healthcare is broken. So what we found is that more than 50% of respondents said that they do struggle with inbound and with outbound communication. So getting messages and communication out to patients, but also patients being able to reach out to the practice. 49% struggle with efficient patient intake before a visit. This is also a lot to do with poor communication and communication obstacles. 48% struggle with appointment scheduling and reminders, and 49% find reaching out to patients who no-show is a real challenge. And these are all different topics. So maybe quickly, Erin and Craig, can you briefly tell us about specific patient communication challenges that your practice was facing before adopting a patient communication platform?
Sure, I can start. You know, I think our biggest challenge was definitely in the very beginning. What we noticed was how we were handling the call volume. So we had, you know, patients coming in, checking in. We had them, the phones going off at the same time. And, you know, it was that tug of war between, do I want to answer the phone and take care of the patient on the phone, or do I want to take care of the patient in front of me? Either way, you were already, you know, giving a poor experience, because if you check in the patient, then they're going to be like, oh, the phone is ringing off the hook and that's me when I call. And if you take care of the patient, then the person on the phone is waiting. So we really had to assess an overall on what we really wanted for our practice and for a better environment for our patients. So we decided that we were going to just kind of filter all of those calls into one group of call center representatives and have them be able to spend that time with each patient, which was a huge, huge impact, certainly for the staff, for the frontline staff, when patients would actually come in. There wasn't that pressure of the phones constantly going off, which was a huge improvement. But then after we had opened our call center, we realized that there was still that gap between the communication between the patient calling and wanting to get those answers from the nursing staff or a refill, and the clinical staff or the provider coming out and calling the patient back and leaving another message. And then it was this back and forth tug of war. I was in there, I was answering those calls. I was right next to everybody, and, you know, sitting in that seat and learning all of that firsthand and listening to those patients, we had to find a solution. And fortunately, you know, when Klara had approached us and we met with them, and, you know, at that time, you know, it was about more about text messaging. But it's altogether so much more than that. And it was a huge turn for our whole infrastructure of our company, for sure.
Great, that's great to hear. And we're definitely going to dive into some of the examples later. Craig, any thoughts on your end? I think you're muted.
How about now?
Yes.
Can you hear me? Okay,
Beautiful,
sorry about that.
Beautiful.
No, I think that it's so much more than text messaging is a very good point. I think I love that Klara breaks it into all those different categories to be considered communication. So even like intake forms, I feel like we're always asking Klara, like, oh yeah, your texting was great. Can you guys like also get it so we can send all of our paperwork out to the patient ahead of time? So I think it's created a very good, simple, centralized component for the entire patient experience, and not just texting back and forth, has been just a huge help in organizing everything.
Mm-hmm. Great. Maybe going on, because we're going to cover some of these examples you just talked about. So on the other side of things, on these basically big key findings, we had the numbers you've just seen on the previous slide. Some other findings were, or one of the main thing is that about 96% of all patient complaints are actually around communication and the patient experience. Only 4% are about the actual care, right? And if you look into these, the main complaints from patients are around, you know, wait times, around billing, and just in general about ineffective and inefficient communication. Erin or Craig, prior to adopting Klara for your patients' communication platform, were you experiencing any of these complaints?
Definitely.
Yeah.
Definitely. I think the biggest one was just the contact between the provider and the patient, and that tossing back and forth with phone calls and messages, and it was exhausting. It took up a lot of time and a lot of frustration on their end, for sure. And of course the wait times, I mean, back and forth leaving messages is just it's not efficient.
Yeah, I think for us, the wait times is something that I've seen dramatically decrease from when we're training people. We used to tell the medical assistants, expect 10 to 15 minutes that the patients are going to be doing paperwork, and we've gotten it down to 6 to 8 minutes now, because we're utilizing Klara to send paperwork out automatically ahead of time, and it's very simple to complete and submit to us. So especially during COVID, that was something that we really went heavy into, and I think that's something dramatically that we've seen a dip in.
Great, super interesting. Now that we've basically discussed the foundation and the finding about the key challenges around communication, let's move on to strategic priorities. So, by the way, this report has been done through surveying roughly 200 really large practice groups and practices around the country, and we could see a pattern in terms of strategic priorities for these practices, which they consider to be extremely important to achieve. And the 3 strategic priorities are improved quality of care, has been number 1, but really close to it, improved operational productivity, so the efficiency of how the workflows are structured in the practice. And then thirdly, of course, improved revenue growth. And as we go forward now, how we structured this webinar is we want to talk about all 3 of those and one at a time. So in the few next slides, we're going to break down each of these priorities and discuss how improved communication is a necessary tool to drive results in each of these areas. Cool. Let's start with strategic priority number 1, improving quality of care. So improving quality of care is an outcome which is driven by a lot of different factors, and what came out of the survey is that 72% are actually saying that they want to improving quality of care comes from a lot of workflows which are inefficient, which don't work, which are actually detrimental to the quality of care as an outcome. And a lot of this has to do with digitization and or non-digitization. So what basically the research showed that a lot of these workflows, which are directly related to improving quality of care, and we're going to come to this in a little bit, are actually for managing appointment scheduling and rescheduling. Another thing was about texting, and the other big topic was that practices really would like to prove and interact with their patients through texting. Erin, Craig, prior to Klara, were your patients requesting new channels of communication with your practice? Or maybe we can start with what channels of communication were you actually engaging with prior to coming to Klara, and were they requesting other alternative channels?
Yeah, and I think when there's a gap, then people go for the path of least resistance. So I think a lot of times what people were doing, we'd get patients who were trying to email us or trying to email physicians, or we'd be like, physicians, please don't email your patients. It's not HIPAA compliant. But then it's hard for doctors who know that the phone system could be backed up, or it could take a while to get to a patient. So they're going to be more lenient about getting answering these patients and things like that, or just knocking it out themselves. So I think Klara definitely gave us this very easy, simple solution to direct all of our patients to this, that, hey, this is going to get to your doctor. It's going to get to us. We're going to be able to respond to you quickly. Even if the phones are backed up, this is still going to be an option for you that you can always utilize. Really cleaned that up. And the quality of care in those examples is we're keeping things out of those messages because they're not HIPAA compliant. So with Klara, we're able to give a full discussion with the patient and answer all their questions right at once. If a phone call's needed, that's fine, but at least we can get as much information out as possible in one message.
Okay, so compared to like email or text messages, which are not HIPAA compliant, this is directly related to quality of care because you can actually talk about clinical topics which are sensitive, and if it's HIPAA compliant, you are able to share that data. Okay.
Yeah.
That's very interesting. Yeah.
Even just with photos too, right? So if somebody's concerned and they've just had the surgery and they can communicate directly with the provider that evening and send a photo, that's a huge help too as well. Yeah. I mean, I think for us, our biggest complaint was, the wait times and getting through to everybody, and patients complained they didn't offer any solution. But I think it's important to listen to what your patients say and to fine tune your practice to accommodate them as much as you can. And with Klara, I think it's really a home run for that, for patient care and the quality of their care, for sure.
And how did your patients react when you made the switch?
For us, we weren't really quite sure how they were gonna be. We have a huge different. All of our offices have a very widespread demographic. So for me, I knew where I kind of had my concerns, but honestly, it was right away. I remember the very first week we implemented it, and patients were coming out to the checkout desk like, "Oh my God, this is great. Oh, thank you so much. Everything is so much faster. It's right on my phone." We had Mo's patients check out, and they were just thrilled with it. So it was awesome start of Klara for our office, for sure. Yeah.
Cool.
Mm-hmm.
Craig, any patient anecdotes?
No, I think it's always a numbers game. We have a pretty high percentage of patients who take to Klara and they enjoy it. But I think it is just giving patients another option to get information, and a certain large percentage of patients are going to utilize it, and that's taking work off other points of the office.
You can't put a number on the value.
Yeah, right.
Mm-hmm.
Yeah. And just maybe looping back once more to quality of care, because it's always such a big topic, right? And it's hard to measure. Craig, you said quality of care is improved because you're actually able to, cut the red tape and actually share data, photos. Erin mentioned. How else do you think kind of a different, more efficient and convenient mode of communication can improve quality of care itself?
Yeah, I think a big thing is that it's a lot easier and quicker to sift through messages and triage them. So when a message comes through, we get it right away. We don't have to have it go to a voicemail first. And there's a bunch of eyes on the same exact inbox at one time. So it's a lot easier to triage that information when there's an emergency or a problem that needs to be taken care of right away. It's a lot easier than getting a message on an email or a voicemail box, sending that to the right person, and it's just a much more centralized and available method of getting information from patients.
Mm-hmm. All right. Anything to add, Erin? Otherwise, we would move to the next topic.
No, we can move to the next. Go ahead.
We could talk all day on all
these. We could go on this forever.
Yeah.
So.
Awesome. So the next one is improving operational productivity, which also some people label as operational efficiency. It's all pretty much the same. So in the survey, it was found that this is strategic priority number 2 for most of the practices. And improving operational productivity is directly related in the research we did to EHR integration. So EHR integration is mentioned with almost every single practice we work with. And with this webinar is supported by Nextech. As I said in the beginning, one of the many EHRs we seamlessly integrate with. So 86% of the survey respondents said that they consider integration with EHR and PM systems very important in order to improve their operational efficiency or productivity. And one of the kind of functionalities of the EHR integration stands out is actually patient sync. So the synchronization of patients' demographics from 2 of the systems that you basically are always pulling from the same source of truth is very important. maybe talking about EHR integration and why in specific this is related to operational productivity. Erin, would you agree with this? And if so, can you tell us how having your communication platform, so Klara, integrate with your EHR, which is Nextech, how that has improved your practice's operational productivity? Maybe you can give some examples and talk about this a little bit.
Sure. One of the really key factors in that was being able to get the insurance information ahead of time, having that export into Nextech immediately, and us being able to look ahead and plan ahead if that patient needed a referral, if we accepted the insurance, if we needed any more information, who the referring physician was, any of the insurance information was a key integration for us, and getting it ahead of time instead of, our biggest struggle was patients were coming in the office and they had it on their phone, right? Yeah. So it's like, how are we going to get it from your phone into our system without emailing it, or how, what are we going to use? And now it's like they just take a snapshot of it and it goes right in Nextech. So that's huge. I think patient syncing and integration, and the more integration, I've always been a huge cheerleader for integrating with Nextech. So the more you do, the less workflow and hold up it is, and two screens and going back and forth, and less actual physical data entry of the reception staff. It works out really well for us, for sure.
Yeah, that makes a lot of sense, and maybe picking on some of these examples. So we dove also into this a little bit more, and talking about workflows which are enabled through EHR integration. Without EHR integration, these are not possible. There's also a lot of automations based on the information we can pull from the EHR and then automate workflows around them. And a lot of them were around the appointment. So if we use Klara as a communication platform, if we integrate it with Nextech or any other EHR, we get access to the appointment date and time, and the appointment type as well, provider and location. And we can customize any type of flows before and after the appointment. We can say 5 days before, please send a pre-visit instruction or insurance card collection request. We are at no-show, we can engage with the patient. Post-visit, we can say 5 days after, please ask the patient how they are, or maybe request some more paperwork and just automatically follow up. So talking about the findings, a 73% actually consider no-show engagement and rescheduling at no-show very important to improving operational productivity. Not only lost revenue, but also there's a lot of work involved in actually engaging with patients if they no-show, because it hurts the practice and you want to refill that slot. 81% consider advanced appointment reminders important, or very important, to improving operational efficiency. It's directly related to no-shows, but if you don't have an automated and really well thought through product there, then it's a lot of calling patients, sending messages to patients manually. And 63% consider self-service online scheduling, which is also something you get if you're integrated with the EHR directly in the conversational experience in Klara, or through the website messenger on the website. There's online self-scheduling. Practices consider self-scheduling important to very important. Maybe to you, Craig, can you tell us about how your practice currently handles the patient appointment journey? So this is basically a journey from reminders to no-shows, rescheduling, post-visit engagement, how you set up, and how do you currently handle the patient appointment journey?
Yeah, so I mean, outside of being able to text with patients, I think the appointment or the auto reminders ahead of time has been one of the biggest components to change our operations. So what we're doing is we're sending out a confirmation to the patients. The patients are confirming. They're then getting a message saying, hey, can you fill out this paperwork? They can fill out the paperwork, send it right back to us. And at this point, then we have a certain percentage of patients, 10, 20, 30% of patients who are all ready to go before, a week before their appointment even happens, which is cutting down our wait times. As you said, it also relates to no-shows, because those people who filled out their paperwork, we know they're coming, they've confirmed, and it's really now we're able to focus on the people who haven't responded yet. We do have Klara send out another message saying, hey, don't forget this paperwork, and then we get another percentage of people who turn that in, and then our staff can just focus on that small group of people that we're still looking for. And that just changed everything, because now the patients are walking in and almost everybody that walks in is already ready to go and go right back to see the doctor, which is where we cut down our wait times, but also we're more effective and efficient at using our staff's time.
Great. And kind of, you mentioned the results, but did you track metrics?
So we
you don't have to share, but.
No, I mean, our no-shows have always been really low, just because we're really big on following up with patients. So, but I do think Klara does a great job at sending out, how many templates are being used and how many documents are being sent back and forth by patients and things like that. So I don't have that percentage, but I do know that our expected wait times has gone down from about 11 to 15 minutes to 6 to 8 minutes per patient. So.
Oh, that's great. And as we saw before, it's one of the big complaints patients are actually contacting practices about.
Yeah.
Great. Thanks so much for that insight. So this brings us to the next topic, which also a lot of these things we talked about are also kind of paying into this improving revenue growth. This is definitely on the mind of a lot of people out there. And what does revenue growth mean? And we found that basically people define it in two ways, and two things are important. One is new patient acquisition. So 45% actually saying that this is the most important, but a lot of people are also saying increasing revenue per patient is also important. You get new patients, but also the existing patients or the new patients you get, you want to increase the revenue per patient. So Erin or Craig, or I think this maybe goes to Erin again, can you give us an example of how streamlining communication at your practice has improved your revenue growth, whether that is acquiring new patients or freeing up staff time, retaining patients, or increasing revenue per patient, or other areas of growth of your practice?
Sure. So within the past couple of years, we've built two new locations. So that's accommodating a whole different realm of patient care and new patients. And with COVID, we found that a lot of people moved from the city into Connecticut. So our patient volume, as far as increased revenue, which I'm sure has gone up increasingly, but statistically, what I found is we are just capturing, like, we're somewhere between 120 and 140 new patients a week in Klara alone. That's a lot of calls, and that is a lot of time, because onboarding a new patient and entering them in the system is time consuming, and you don't want to rush it because it's your first impression. So if you're on the phone, it's a hold up. It's a special call. So with that alone, I think the new patients that we have, and along with the patients that we have adapted to Klara, it definitely has made a huge increase in our growth, for sure, financially and just patient care wise.
Interesting. That's great to hear. Craig, any insights on your end?
Yeah, just I mean, I guess one anecdote is, I think looking at the number of phone calls we got when we started using Klara, so our Klara numbers keep going up. We're in thousands of messages every, but our phone time has actually stayed pretty consistent still as well.
Yep.
And a lot of people are like, well, why is that? And I think it's a big portion of that is that patients who want to get through and are only going to call once are getting through now, and they're able to go and text as well. So there's this component of freeing up the phone lines, and there are people who are only going to call once and not waste their time, new patients and things like that. They'll find somebody who will answer the phone. So giving the option to, hey, you can hang up and text us, or just freeing up the phone line in order for more people to get through, I think is where those two numbers are both going up at the same time.
Yeah, Craig, I'm glad you mentioned that because it is true. It's kind of like, so we're going to get this text message system and our numbers are going to go down. But really what you're doing is able to accommodate all those patients that wouldn't wait, right? So how many are you losing that you don't even realize you are, that are just like, forget it, I'm just going to go somewhere else.
Right.
You know?
Yeah.
Okay, so the argument is actually, it's like a funnel and it's a hose, which is just, or it's like a pretty big stream of inbound phone calls. And I don't know what percentage you're actually not able to capture because they drop out. And I think I have read a statistic, 60% of people who call any business drop out after, I think, 30 seconds wait time. And then they're gone. So your argument is actually that the quality of calls has increased. The volume of calls you're actually capturing has not decreased, but now everybody gets through because you have this additional channel of Klara, which is very efficient. And then you can basically now capture a lot more business.
Yes, absolutely.
Yep.
Cool. Interesting. Great. I think we are already coming to the report conclusion. Now understanding these three strategic priorities: improving quality of care, improving operational productivity as a second strategic priority, and then improving revenue growth. Maybe last question, Erin and Craig, what would you say to a practice that is looking to streamline its patient communication using new technology?
I would start by really doing an assessment of what you're looking for and what your goals are for the practice and patient care. But in turn, I would also reach out to all of the areas of the staff, whether it be billing, providers, front staff, clinical, lab, even if there's any issues with prescribing, because we are integrated with different specialty pharmacies as well, and just kind of take an assessment of where you're at and what goals you want to make, and kind of set that plan for moving ahead in taking on new patient communication. And it's a big job to do, and it can be very very difficult convincing the people that you are implementing this with that we're taking on a new technology now, because a lot of people don't want to hear that and they don't want to deal with that. And it's like, oh, why are they torturing us? But, as long as you can forge through and roll that out in a positive way. I personally dealt with that. And within, I think, a couple weeks, it was like, wow, how did we live without Klara? This is great. This is great. I'm like, yeah, you didn't say that to me 2 weeks ago. Okay. But I'm glad we're on a positive note now. So don't get discouraged, and it's well worth it. It is 100% well worth investing that time into the patient care and the communication, because it's not just for the patient, it's for everybody. It's to be able to communicate internally and get those and a better workflow. And yeah, it's a great process for sure, for all of us.
Great. Any advice or insights you would like to share, Craig, to practices who are thinking about improving their communications through technology?
Yeah, I think, I think what Erin said there of taking an assessment is really important. I think there's a kind of tendency for people to try to just give everything to technology and forget, the patient experience, or even not quite be ready to take, not quite ready for the technology to take over all parts right at once. We were lucky to kind of grow with Klara, so we were able to kind of implement as they came out with new features. But I think something I always think about when we're adding new features, it's like, if you think 5 years down the line, there's no future scenario where we're not interacting with patients digitally. So we need to just kind of start embracing it now, and more people are looking to do so. And Klara's offered a great centralized streamlined process for the entire patient experience, not just texting. So I think that's been great. Yeah.
Great. Perfect. It looks like we are at the end of the presentation, and we have about 10 minutes left. So thank you, Erin and Craig, for sharing your opinions and experiences. It was a really great discussion. I loved a lot of the points you were bringing, and I hope this helped the audience as well to understand a little bit further. Now that we have about 10 minutes left, let's move to Q&A. As I said at the beginning of the presentation, there's a little chat or the Q&A button in your Zoom. Please feel free to enter some questions. I already see some questions coming in, so let us, I just share the screen real quick to make it, oops. So, cool, let us go to the first question. The first one is, I love that forms can go directly to Nextech, as Erin said. I would love if it would be possible for intake forms to go directly to the EMR portion of Nextech instead of just a PDF in the history tab. Currently, if a patient fills out an intake form on the Nextech portal, it goes directly to the EMR section. Would love that as a future change for Klara. Totally, it's a great point. It's actually something we have started to build a team around last quarter, and we are actively working on this right now. You can create any type of forms, consent forms, but also intake forms. They come back as a PDF and they're automatically pushed into Nextech. We're currently working on a new version of this, which will be more integrated with the EMR. There's no release date yet, but it's coming in the near future. So stay tuned for that. Next,
if I could just to say, we kind of discussed that kind of back and forth on if we were going to stick with the portal because it goes right into the EMR or just go with the PDF. We found that it's much easier. You know, the portals are not very easy for patients to get into. Patients don't want another app. They don't want to have another login. So it was so much easier for us just to go with Klara and text messaging those things than to kind of fight with patients to go with the portal. And we found it just to be a more streamlined process, even though we still have to go back and enter some of that information again.
Good point. Now, I think this was going to you, Erin. How does your front office balance answering the phone, sorting and answering Klara messages, and checking in and out patients?
So, for our front end, they don't generally they just check in the patients. We only have one phone line that's directed to our front area. That is, if it's a doctor actually calling that needs to speak to one of our providers. All of our phones are filtered into our call center. So they are in lead of answering the calls and maintaining the Klaras throughout the day. If they check their Klaras if they're in check-in or check-out just for internal communication, or if it's assigned to them to answer or communicate with that patient specifically for a certain reason. But the majority of it is in our centralized call center, and they work it all day, all the time. So
great. So to the next question, we have some minutes left, 6 minutes. Since implementing Klara for patient communication, would you say that it has had a positive impact on your online reviews? Erin, Craig, whoever wants to go.
I don't know about that. I wouldn't be able to say yes or no. I do think that we do get some people who don't like the texting, and they'll post like your texting is terrible. I think there is a component too of training your staff to utilize the phone still. People sometimes will just lean too heavily on Klara. So it is something that we're always saying, if this is a phone call, make it a phone call. So I think we've had some instances where that happened. But I don't think I've noticed any huge upticks or downticks in our.
I agree. Probably
views.
The same for sure. Yeah.
Are you using the review request automation?
Ooh, we're not. No, we should be.
No,
we
we're
should
not
be.
either.
No. I think you should talk to
we don't want to know.
We
don't want to know.
Yeah.
We don't want to know. It's better. Yeah.
No, but you can actually prompt specific appointment types again. You don't have to do it with every patient, but you can set up a automated cadence post-appointment, and you can 1 day after, 2 days after, to basically reach out and say, were you highly satisfied or were you not highly satisfied?
Mm-hmm.
And if they press 1 or 2, you get that feedback, and then you can send them to a review portal. And also you can get the feedback and contact the patient because it's always a two-way message. So we are actually seeing a lot of customers who report specific numbers about significant increases in online reviews. We'll
Add it to our list.
have to
should,
talk to
yeah.
the customer success
Jump
manager.
right on that.
Let's get you up and running with this. Quick question: are you integrated with Athena? Yes, we are. We are fully integrated with Athena. This is done. Cool. We have 4 minutes left. Please teach me to use Klara as a review generator. I want this so badly. Okay, no problem. Just reach out to us, and we're happy to do that. So what else? You had mentioned integration with pharmacies, Erin. You are, if I'm not, if I'm right, you are doing communication with specialty pharmacies. Maybe you can talk a minute about that.
Yes, if there's any issue, we have used Connecticut Pharmacy, and if there's any issues with a prescription with a patient, we can just have that message them directly with the patient information and go back and forth and find a better solution. Or if it's too expensive for the patient, they will, submit a different one. And then of course you're keeping in touch with all of this communication with your the provider too. So the provider can read everything that's going on as well, as long as they're in that loop. So we use it for any issues that the pharmacy, might run into with insurance or something, a referral or.
So maybe to clarify real quick, Klara, there is what we call cross-organizational communication. So if two practices or practice and a specialty pharmacy both use Klara, they can create a group conversation. And this is basically a three-way conversation between the two organizations and the patient. The patient is always in the conversation. So we found that a lot of other customers are using this to communicate with specialty pharmacies, especially around prior authorizations, because there's a lot of back and forth through the phone and getting all the information ready to push through the prior auth request. And now we're seeing also other use cases about billing companies being connected to multiple Klara customers. And if you have a network of organizations you work with in onboarding, you can tell this to our team, and we are happy to help you onboard this network. They have to be Klara customers in order to take care of that communication, but that's definitely possible, and it's also a strategic edge where we think we can do much more. Maybe last, we have 2 minutes left. Last question here coming in. Where do you think, and maybe both of you can take a stab at 30 seconds, where do you think your practice would be today if you hadn't implemented Klara or a patient communication platform? Erin, you want to go first?
I don't want to know. Really, I think it's really become the bread and butter of our practice for sure, just as much as our EMR is. And you can't, the biggest part is the documentation, right? That was our one of our tough areas is, now we can see the whole conversation. We can clue in our billing department. If somebody has a billing question, we're able to communicate with them through Klara as well. So all of that documentation, it's there now, where before, if a patient called and complained, I would have nothing to go on, nothing. If they said, oh, I didn't get a call back, or I didn't get a response, or it's all right there for me to refer to. So it's fantastic. It's great for employees, for being able to keep everybody accountable. So it's far beyond, I don't know what we would do without it. I really don't. Mm-mm.
Yeah, I think
I've always said that, but it really is true. It's true.
I think I look at it from like a growth standpoint of, I don't know, as you get larger and larger and you have more and more patients, you just start to see and feel that the phones are not going to be an appropriate way to manage all of the different types of calls you're going to be getting all day long. And Klara kind of created an outlet for organizing all of that. And so now when we're thinking about like adding more providers or adding more patients here or there or things like that, we know that we have the infrastructure in place to do so, where we would have just had to keep adding more and more phone people to the phone room, and we'd still have phone lines and things like that. So and complaints about holds. And so this really gives an infrastructure in place for you to kind of keep growing and feel confident in that.
Great. Awesome. It looks like we are at time. Thank you for the participation, both Erin and Craig. It's been a fantastic 45 minutes. Thanks for joining this. Thank you, Nextech, for also partnering up with us on this webinar. And thanks for everyone on the Klara side to prepare and help this webinar to take place. If you have any questions, the participants were so kind to also offer leaving their email addresses, which you can see right now in the screen. So if you want to contact them, get direct feedback, feel free to reach out to them. Also, send us an email, hello@klara.com, if you're a new customer and you're interested, if you're a prospect and if you're interested in becoming a Klara customer, or if you are a customer and have heard of any of these things like maybe review requests today, feel free to reach out to your customer success manager and we will help you to get this in place, or also help you with any other automations, appointment reminders, no-show engagement, post and pre-visit in engagement. This is what we do, and this is where what we are here for. So thank you, everyone. Again, a reminder, we will send a recording to everyone who has joined the webinar and was registered. We will also send our industry report to everyone, and are super excited to be publishing this soon, and you will get a sneak peek to it. So again, thank you very much. Have a great day and rest of the week, and stay safe.
Thank you, you too.
Thanks, everyone.